Growing confusion over how and where Americans will get the new COVID vaccine, with changes to vaccine policy fueling turmoil at the CDC. Just as the new vaccines are rolling out to pharmacies across the country, CVS announces it will limit access to the shot in 16 states, requiring prescriptions in 13 states, including New York, Florida, and Colorado, and simply not offering it in 3 others. Walgreens says they'll give vaccines in states where we are able to do so. It comes just days after the FDA approved the COVID vaccine for this fall, only for Americans over 65 and adults and younger people at high risk. But a critical CDC panel is not expected to give their recommendation for several more weeks.
Because of that uncertainty, it is putting a lot of hesitancy among pharmacists and patients around what that coverage may actually look like at the end of the day.
The White House insists the vaccine will still be available for all Americans who want it, but pressed on whether insurance will continue to cover it, the White House sidestepping.
The FDA's decision does not affect the availability of COVID vaccines for Americans who want them. We believe in individual choice.
It comes as HHS Secretary Robert F. Kennedy Jr., a longtime vaccine skeptic, moves to overhaul U.S. vaccine policy, this week ousting the head of the CDC, Susan Menares, when she refused to get on board with his changes. Her lawyer saying she refused to rubber stamp unscientific, reckless directives and fire dedicated health experts. But RFK Jr. is plowing ahead, naming his deputy Jim O'Neill as the interim CDC director. This is someone who has said in the past that he supports vaccines, but not vaccine mandates. But right now, you already have COVID cases ticking up and the winter season approaching. Some medical groups are warning against putting limits on who can get the shot, saying that this could have dangerous consequences. Mary?
Yes, so many just looking for some clarity. Selena, thanks.